So Chris, we're seeing Sam next with his mother Heidi. What can you tell me about Sam?
Well, Sam is a 4-year-old boy who has been referred to us by his local GP. On the referral, it states that he has difficulty hopping, jumping, and that he has low muscle tone. It also says that he has poor balance and that his Kindy teacher has brought up some concerns she's having about this with his mother Heidi. The teachers or parental concerns are not in the referral, so I will need to ask those questions in my subjective. There is no past medical or surgical history of any significance, and he is not on any medication.
Great, that's comprehensive. How would you like to structure your session with Sam today?
Well, I want to have some toys out so that Sam can play independently, and so I can ask Mum some questions on the side about her concerns about the referral and both the reports that she's been gotten from Kindy. I then want to ask Sam himself some questions about what he likes to do when playing. I think from that, I'll probably be able to gather some information about where his difficulties might be, and then I'll be able to do an objective exam from there.
Okay.
Because he is 4 years old, I only know of the movement ABC and an NSMDA. If from my subjective assessment there appears to be any sensory difficulties, would an NSMDA be better?
Probably, it's got the sensory component, so that sounds like a good plan. Do you have any thoughts about what questions you might like to ask Mum?
Well, yeah, I want to ask her about if she has any thoughts or concerns about the referral and the complications he's having at Kindy. Then I want to confirm his medical surgical history, plus get a developmental background on him, birth history. Then I kind of want to ask Heidi about his current development and activities that he likes and dislikes to do. And then I want to ask some questions that will give us information on his sensory systems.
Sure. So how would you plan for your objective assessment?
Well, based on Mum's answers, I'll decide which assessment format would be better, and then complete that, or we'll get as much done as Sam can. Would it be okay with you if I confirmed before I start the objective assessment?
That sounds like a good plan. Are you ready to start now? Do you have any other questions?
No, I'm all good. Cool.
Okay. I've seen Heidi this morning and she's happy to have a student assessment, so
Awesome.
Let's go get started.
Brilliant. I'll just go get my forms from the desk and clean up the room.
Great.
Hi Heidi, hi Sam. My name's Chris and I'm a final year physiotherapy student, and this is my clinical educator Kate.
Hi Heidi. Hi Sam.
Hey Sam, how you going today?
Fine.
That's good. Alright, would you like to go and play on the mat with the toys with Kate for a while I have a chat to Mum?
Shall we play?
Good boy.
Play?
Thanks for that. Alright, so Heidi, this will take about 60 minutes or what you and Sam today, and likely we will be able to work out some activities for you and Sam to do at home. So I see on your GP referral here that Sam is in Kindy and some concerns were expressed by the Kindy teacher about his progress there.
Yeah, the Kindy teacher just let me know that apparently he's having trouble sitting still when they're all, playing on the mat.
Yep.
And also apparently that he's quite behind in his drawing and cutting skills.
Okay.
We haven't actually made any changes at Kindy yet though. We're sort of waiting for your recommendations today.
Okay. Would you have any other thoughts or concerns to do with Sam?
Yeah, I guess my main concerns are that he's really quite clumsy compared to the other kids, and he's still not dressing himself, so I'm working with that. And one of the other main things is I find that he's a really fussy eater.
Okay. What about, does he like outdoor play? Is he into playgrounds, slides, that type of thing?
He's kind of more of an indoors kid, to be honest. His dad's Brian, which is a musician, so Sam also likes music as well.
Yeah.
We have tried sort of lots of the boy type games like throwing balls and things in the past, but he doesn't really like it. We do go to the playground, of course, but yeah, he's not really interested in the slides or climbing up high on the equipment.
Okay, so when you say that he's not interested in slides and climbing up things, do you have any thoughts on why that could be?
Well, he seems quite scared, I think, of trying those things.
Does he like swings?
He loves the swing. It's hard to get him off.
So does he walk along those wobbly sort of bridge sort of things that
We did try that once, but it didn't go very well. He fell over and he won't do it anymore.
Okay. So do you think that those wobbly type of bridges and sort of things that test his balance might be a bit difficult for him?
Yeah, I think so. It does seem pretty tricky.
Okay. Do you think that activities like climbing and the slide, sort of activities that take him off of the ground, might be a bit scary for him?
Yeah, definitely. Yeah.
He does like to move around. He's a fairly active boy.
Absolutely, yeah. He loves to move.
Okay. So how's he like with rough and tumble play with Dad and the brothers?
Oh, well, as I said, Brian's a musician, so he's not really the rough and tumble kind of dad.
Yeah.
But sort of how you mentioned, I guess, Sam does kind of slam himself into me sometimes, and he can be a bit rough with some of the other kids at Kindy. But I guess he doesn't really play that much with his older brothers because they're older, so they're off doing their own thing a lot of the time.
Okay. And what's he like with messy play?
Oh, messy play. Well, we don't really do a lot of that, but he is a pretty clean boy. He likes to have clean hands. I know at Kindy they do some sort of finger painting and things, but yeah, we probably haven't done a lot of it at home. I guess he does really like to wear shoes as well, so yeah, I guess he's a pretty clean sort of kid.
And you mentioned earlier that Sam was a fussy eater.
Yeah, he's really fussy. It's really hard to introduce any new foods. I find I have to bribe him a lot. I don't know whether it's a texture thing, but yeah, he just really struggles with new foods.
Okay, cool. So Heidi, I'm just going to move on to some questions about Sam's birth and development, if you don't mind.
Oh yeah, sure.
Okay, so was he born at term?
Yeah, he was, but we had a planned cesarean because he was breech.
Okay. Was there any difficulties or problems during either the pregnancy or the delivery?
No, everything was fine.
Okay, and is there any other medical or surgical history for Sam?
No.
Okay. Is he on any medication at all?
Oh, he just takes a multivitamin, but that's mostly just because he's so fussy with eating.
Did he enjoy playing on his tummy as a baby?
No, not really, but we did keep trying.
Okay, and whenabouts did he roll?
Ooh, I think it's about 7 months.
6 months. Okay. And did he crawl at all?
No, he didn't actually. He kind of shuffled around on his bottom for a little while, and he just started standing up.
Okay, and whenabouts would you say that he started to walk?
It was a little bit later than my other boys. I think it was about 18 months.
18 months? Well, that gives me a lot of information about why I think he might be having some difficulties. I might just do the assessment with Sam now, seeing as he's been sitting there for a while. He looks like he's ready to start moving.
That's you.
Okay, Sam, you ready to play some games with me today?
Yeah,
Alright, join me on that. Hey, Kate, I'm looking to do an NSMDA. Would that be okay?
Yeah, that sounds like a good idea.
Cool. Alright, so hang just jump there. So, tell me, what's your favourite animal?
Hippo.
Oh, those are good. What about your other favourite animal?
Crocodile.
You got another one?
What else, Sam?
Crocodile eats it.
What about kangaroos?
Kangaroo.
Yeah, you like
The
that.
giraffe.
Yeah. What do you do to the zoo?
Okay, so now we're going to play like a little bird, okay? So you're going to have to follow it. Good boy. Watch where it is, watch where it is. Do you want to go trying to make it fly? Up and around, the bird fly. Good boy. Okay. Now, your mum looks as if she might want a necklace. Do you want to make her a necklace?
Oh, Sam, I would love a necklace. Can you make one for me?
Well, give it a go. See these ones? I'll see you later. Here, we'll move on to the necklace now. Alright, so what I'm wanting you to do is see these beads? I want you to thread the beads on the string and make a pretty necklace for Mum. Do you want to have a go at that?
No.
Come on, one time. Couple more.
Can you please make me a necklace, Sam?
Good boy. Can you do it yourself? That's a boy. Come on. Good boy. Pretty colours. Do you want to put on a couple more? Boy.
You gonna come and put that on me, Sam? Oh, thanks. We try it on. How does it look?
Good.
Oh.
Oh wow, that's a really good drawing, Sam. Here, I'll just put this one to the side. How about we jump up and play a game of catch? You want to do that? Come on. Come on, up here with me. Good boy, Sam.
Standing up.
You there? Right, ready? Big catch. Oh, good job. Now big throw, come on. Oh, come throw to me. Good boy, Sam. Here you go. Oh, good catch. Yeah, have another go. Big throw. Oh! Arm on him. Alright, there you go. Come on back. Great. Alright, just jump over here. Mum, we might need your help for this if you don't mind.
What's this?
You ever been in a circus?
No.
Do you want to try and be in a circus? Here, let's do some tightrope walking. Right, here you go, Mum. Do you want to hold the end of that?
Okay.
No,
Cute.
I want to.
You're gonna you. I can hold it, I think. Sam?
Right, now, like a trapeze artist. Just walk along it. Good boy. Great. Good job.
Good job.
Now, do you want to try some jumping? Let's try some jumping. That's a really good idea. Come on, let's pretend to be kangaroos. Come on. Ready? Hop, hop. Jump like a kangaroo. Right, that was some great standing on one leg like an emu, Sam. Now, come here. I'm going to pick you up now. Mr. Kangaroo has to see where his friends are, okay? Come on, jump up. Come on.
Stand up, buddy.
Good job.
Yeah.
Alright, now, you're going to have a look out for Mr. Kangaroo's friends, okay? And you're going to tell me if you can see him. Alright? Alright, we're going up. Whoa! Can you see him? Can you see him? No? Alright, good boy. Now, well, we couldn't see them. Maybe they're out at night time. Should we see if they're out at night time? Alright, now, we were just looking with our daytime eyes. Now, we're going to look with our nighttime eyes, okay? Let's come around here.
Put the mask on.
Wow,
The
special
mask on.
No peeking.
Alright, so nighttime, daytime, nighttime. Daytime, nighttime, okay? Now we're going to have a go with nighttime, seeing if you can see your friends. Good boy, hold it there. Right, up we go. Whoa. Can you see any of them? You can't see any of them? Why can't you see any of them? Really good flying game, Sam. Now I'm going to need you to lie down for me so I can test these big long legs of yours, okay? Lay down.
Laying down.
Lay down on your back.
Good job.
That's a good boy.
Lay down.
Alright.
Sit.
Floppy legs, floppy legs.
Just relax.
All the way
Oh,
down,
that's
buddy.
good,
It's okay.
boy.
Good
Floppy
job.
legs.
Hello. You're doing so well, buddy. We're nearly finished, I think. What do you think?
Okay, now I need to test your arms a bit.
Sorry.
Alright. Alright, stay down. Good boy. Keep your arms loose. Relax, relax. Floppy, floppy, floppy. There we are. Good boy. One arm left, and then we're done. Good boy. Good boy, that was good.
Good job, buddy.
Alright, now if you want to sit up, that's a boy. Sit up. Get back. Good boy. Okay, so your hands in your lap. Good boy. Now I need you to shut your eyes and tell me where the flies land on you, okay? Be a good kangaroo. Good boy. Where'd that one go? Good boy. Another one? Where'd that one go? Good boy. What about that? Shut your eyes. Good boy. What about that? Show the finger, okay? That one. Okay. Now you ready to play some Simon Says? Okay, good boy. Open your eyes up. Now, arms up. Arms up. Oh, they're getting there. They're getting there. Can you lift them up for me?
Simon says, copy Chris.
Come on. Right. Can you do this one? Come on. Hey. Yeah. Almost. Good boy. Now, front.
That's it.
Good boy. Now can you do one up, one down? One up?
Where's the other one?
Where's the other one? Simon Says one up, one more down.
Trying.
Close enough. Alright. Oh, it's coming up. What's this one? Good boy. Good job.
Alright, next last one.
Alright, so I need you to put your hands there. Come on. And now I want you to follow what I do with my hands, okay? Where's the other one? Get your other hand here. Good boy. Okay. Do this one. What about that one? Try this one for me. Good boy. Thank you for that. Really good job there. Good job. Okay, and I think we're pretty much done there.
Is there anything else? Anyone else that's fun items you want to do? Or are you all done?
Yeah, that was fine.
Cool, great. Well, if you want to have a chat to Heidi, Sam and I on the play, I think we're just about out of time, aren't we? Let's have a play.
Absolutely. Okay, Heidi, so I'll just go through some of the findings we found through the assessment today. Well, firstly, Sam listened and interacted well with all the tests I gave him. He has some really lovely skills, but it does seem he has a couple of areas that he needs to work on. For instance, his balance is a little bit less mature than is expected as his age. And as you could see, well, as you could probably notice, he had a bit of trouble hopping, standing, and balancing.
Yeah, that does seem like a pretty good summary, Chris. Any reason why they might be difficult for Sam?
Well, position copy does use information from the proprioceptive system, and that's basically where the body knowing where its joints are. And this could be the reason why Sam's having some issues with cutting and some of the fine motor skills.
Hold on.
Yeah, the brain makes a roadmap of our body parts.
Yeah, that's a really good way of putting it. I also did notice that he was a bit nervous when going up with the blindfold on. And when the vision's take away, the body has to rely on its inner ear or vestibular system to sort of counteract and use its balance. And this could be a reason why he finds climbing and slides a bit difficult for him.
Okay.
I'd agree with that, yeah.
The other thing I noticed that his muscles are a little floppy when you move his arms and legs up and down.
I did notice that when he was a baby.
Yeah, so this is just how awake the muscles are. And when the muscles are a little bit sleepy, it takes them a little while to warm up so the body can use them for balancing and stay steady and still. And as if you move around a lot like Sam likes to, those muscles aren't really getting enough attention.
Oh, okay. So is there somewhere that we can sort of wake up those muscles?
Well, there are a few areas to focus on, but we can easily just start with a couple of easy activities just incorporated into normal life. These are going to look a bit different to normal play because these are going to focus on the muscles that Sam's not using to stay steady and still.
Okay, I'm sure we can manage that. Life's pretty busy, but as long as we can work them into daily life, that should be fine.
Cool, that sounds good.
So, Chris, how do you think that went?
Yeah, I definitely think it went really well. He managed to finish all the assessment and the objective findings matched my subjective, so can't be happier than that. I do still need to score his NSMDA, but from what it looks like, he'll probably fit into the minimal to mild deviation range. I think he looks like he has some sensory difficulties, hypertonia, and he does definitely seem to have some movement difficulties. Do you think that he's just the lower end of normal, or do you feel that his difficulties are maybe more significant?
Well, it looks like some of his difficulties today could fit with a DCD diagnosis, but we'll probably have a better idea after a couple of sessions of therapy.
Yeah, could you remind me what a DCD?
Yeah, it's developmental coordination disorder.
Oh, yeah, actually, I think I remember hearing about that from one of my PEDS lectures at uni. I'll just have to go back and look at my notes.
No worries, just before your next session's fine. So what are Sam's problem areas?
So I think that his low tone is probably affecting his posture and core strength, and also some of his joints did seem a bit hypermobile.
Yeah, so often low tone and hypermobility can go together.
Yeah, that makes sense. Also, he did have some difficulty with the proprioception on testing.
Yeah, I'd agree with that.
He does seem to like moving around, but as long as it's not too challenging. So maybe these vestibular difficulties could be contributing to his difficulty with balance.
Okay, so what are your plans for treatment and therapy?
Well, I'm going to give one activity each on the areas we've discussed for the home program, and I'll book a 6-week block for him and change the home program as he progresses.
Sounds great. Is there anyone else you'd like to involve in Sam's therapy?
Well, I thought I would send a report away to Mum, the Kindy teacher, and the GP, but I would also like to refer him over to an OT as well, but of course we're going to have to get Mum's permission for that. Also, I was thinking of sending a program to Mum and the Kindy teacher for that as well.
That's a great idea. Okay, well, do you want to go get started on all that?
Yeah, absolutely, but first would you be able to co-sign my notes after we're done with that?
Sure, once you've written them, I'll co-sign them.
Awesome, thanks for that.